Hi, I'm Lauren Massey, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about caring for a plantar fascia injury with physical therapy. So what is the plantar fascia? It's a very thick connective tissue that runs through the sole of your foot between the ball of your foot and your heel. Some of you may have experienced that pain first thing in the morning when you first step out of bed and you go, ooh, and you have pain in the arch, or sometimes it's localized right in the bottom of your heel. The plantar fascia is meant to have a little bit of pliability to absorb shock as our foot hits the ground, but not too much. And that's the problem sometimes with today and the poor footwear that we wear, poor arch support, that starts to tug down and can pull on that bony insertion. So what are some of the causes of injuries? Like I mentioned, it can be poor footwear. It can be poor balance and strength in the muscles of your foot and even up into the larger muscles of our hips. One thing I often tell my patients is we don't want our little foot muscles doing all the work. Usually if we have foot injuries or problems, it's because something farther up the chain isn't doing its share. And now these little tissues down in the foot can be getting injured. The plantar fascia, like I mentioned, is that thick connective tissue, but it can actually tear in extreme cases. Now, plantar fascia tears are very painful, but we want to make sure that, again, we take the pressure off as quickly as possible. One thing we can do here at Bay Area Physical Therapy is musculoskeletal ultrasound. We can look at the tissue and say, hey, is it just a little bit thick and inflamed, or am I actually seeing signs of tearing? Depending on the extent of the injury, sometimes it would require putting you in a boot for a while. That's not something that we issue from here, but we would refer you back to your doctor or to a doctor to begin with if we are your first access point to the medical field, to make sure that we get you in a boot to minimize the excessive motion through that area to allow that tissue to heal. There are surgeries to repair this area. I will say foot surgery should never be your first go-to. Foot surgery takes a long time to recover from, and again, we're all up and moving around, and it can definitely impede upon your life. So we want to try the conservative care approach, immobilize the area if necessary, if we are seeing signs of actual tearing, and if it is just inflammation, overstretching, poor mechanics, that we can make sure we set your foot up for a good healing environment. Sometimes that does include arch supports in your regular day-to-day shoes. It could mean making sure that if you're wearing flip-flops, there's a good arch support in your flip-flops. And again, making sure that you have strength in the area more proximally or further up the chain in your leg to decrease the stress down into the foot. Also, your calf muscles come down the back of your leg and wrap around the bottom of your heel, inserting into that same area. So oftentimes, stretching your calves can be crucial to your recovery, and it could be more of a calf tightness issue than a plantar fascia problem. So your physical therapist can help you figure that out through testing on evaluation day. We can help to guide you in what might be the best approach for you, and if you are having too much pain, we can help you control that pain through some of the modalities that we have, like the Class 4 laser, like our electrical stimulation, and then make sure that we get you doing those stretching and strengthening exercises to get you back to normal as quickly as possible. Some of the other things you can try at home for treatment would be icing. So you can freeze a water bottle, those plastic water bottles, throw one in the freezer, and you can roll that through your arch. So you're actually doing a little bit of self-massage and icing at the same time. Just one tip that you can give a try. If you would like more information on our Class 4 laser, please see our vlog entitled How a Warm Healing Laser Can Improve Physical Therapy Results. If you need any further advice, please call our front desk today for a complimentary consultation. Thanks so much.